Hey everybody, it's Erik. Welcome to the Correspondence Corner this week. In Minnesota, I met with quite a few constituents expressing their concerns about the direction healthcare reform is going and updated folks on the new health reform models that are going to be put into place hopefully in the next few months. In Washington, we had several meetings with a whole host of different folks, medical device companies, different folks coming in talking about tax reform, and of course I also had a chance to meet recently with the Special Olympics. They were hyping up the polar plunge, and something I participate in every year. And on February 24th, in Burnsville is going to be the next polar plunge. Hope to see you out there in Burnsville. Thanks everyone for joining the questions here. We're going to start off with Sharon in Minnetonka. And she says, Dear Congressman Paulson, last Congress you introduced the Health Savings Act, and as your constituent, I'm writing to let you know that I'm very much in support of this legislation. Healthcare savings account plans slow the growth in healthcare spending. A 2012 study found that families with consumer-directed healthcare coverage, like HSAs and FSAs, spent an average of 21% less in the first year after switching from traditional coverage. The study found that even if half of consumers who had employer-sponsored coverage were in such plans, healthcare costs would fall by another $57 billion. Please support this proposal in the new Congress. Sincerely, Sharon. Actually, Sharon, thanks for letting me know your thoughts on that issue, and we're right on top of it. I'll just let you know right off the bat, I've just reintroduced that bill along with Senator Hatch in the Senate. We hope that this will actually be a component of the replace for the Affordable Care Act for new healthcare savings accounts. And what a lot of people have come to appreciate is since healthcare savings accounts first started in 2003, now more than 20 million Americans are using them as a part of their healthcare savings and insurance model. But if we expand them more and allow more flexibility for purchasing prescriptions and over-the-counter medications and allowing seniors more access to the using these accounts as they go into Medicare, we can also impact and lower healthcare costs. And I'm really optimistic that this legislation is actually going to pass and move forward this year. Next up is an email we received from John in Plymouth, and he wrote in saying, Dear Representative Paulson, my name is John, and I'm the owner-operator of a micro distillery that has been in operation since July 2015. I just wanted to write to thank you for the support and all of your efforts on H.R. 747. Tax parity for craft distillers would be incredible and allow us to further invest in our business and compete with the larger producers. I currently have 30 employees in our business that I started from scratch. This tax parity would allow us to further invest in our business and provide more jobs to our community. Thank you in advance for your support. Sincerely, John. Actually, what John is referring to is the legislation that I have been authoring. It's called the Craft Beverage Modernization and Tax Reform Act. I recently reintroduced this bill. Senator Wyden is carrying it in the Senate. We have bipartisan support. Last year we had 288 co-sponsors, and we're building up our co-sponsor list again this year. What it simply does is make sure that we're recognizing that small craft brewers, small distillers have high excise taxes. They have a lot of paperwork to go through, and if we modernize the tax code for these folks, they can continue to grow and expand their business and hire more people. It's a big economic driver now for a lot of our local communities. So hopefully we'll move this legislation through as well as a part of tax reform. I want to thank everyone for joining this week. You can reach out anytime on the website at paulson.house.gov or of course on Instagram or Twitter or on Facebook. Have a great weekend and a great week.